My name is Dr. Nathan Goldstein. I'm an associate professor at the Mount Sinai School of Medicine in the Department of Geriatrics and Palliative Medicine.
My name is Sean Morrison. I'm a professor of Geriatrics and Palliative Medicine and direct the Hertzberg Palliative Care Institute at the Mount Sinai School of Medicine. Palliative care is a relatively new team-based specialty that focuses on improving quality of life for persons living with serious illness and their families. It does that by treating pain and other distressing symptoms, helping patients and families arrive at decisions about what treatments meet their goals, and helps patients and families coordinate a very complicated medical system. It's provided at the same time as all other appropriate treatments, including those directed at cure and those directed at prolonging life. And indeed, it provides an added layer of support to patients' families and their health care providers.
I really think one of the things that we do and that we do well is kind of translate medicalese back into English, so patients and families really understand what's going on so they can make the best medical decisions. So our textbook, Evidence-Based Practice of Palliative Medicine, it's the first edition, I think adds a lot of things to the field. One of the things it does is it really does synthesize the evidence around the field, and it both synthesizes the evidence and critiques it, which I think is new and novel. The other thing that we're really proud about in terms of the book is it's easily digestible. So instead of it being this huge tome that covers everything, it's divided into very succinct chapters, and the chapters are divided into clinical questions. So it's not nausea, it's how do I treat nausea in this patient? It's not pain, but how do I manage pain medications in the outpatient setting? And so they're very specific clinical questions. So we sort of sat around and thought, like, what are the questions that we have on the wards? And each chapter is one of those questions. And so I like that because it's a very clear question with a very clear answer, and the chapters can be read in lots of different ways. So there's the question, which is the chapter title, and then there's a little box that gives you the main bullet points. So you can do nothing more than that. You can go into much more in depth, whether it's reading about the epidemiology around that particular question, whether it's reading the critique around the question. There's a special section in there which is sort of how do you talk to patients and families in relationship to the question. So you could read the whole chapter, you could just read the box, or you could read sections of the chapter. And I think it's been created for the busy clinician, whether that's student, nurse, physician, doesn't matter. So you can pick and choose the parts that you want, particularly to answer it in an efficient way. And I think that's what makes it different also, is it can be, you can get your question answered efficiently.
The only thing I would add to that is that it is both available as a printed book, but more importantly, I would say, at least hearing from people who have bought the early version, it's available online. So that when you're seeing a patient in your office, you're seeing a patient on the floor, you're a medical student walking between classes, and you have a question, it's really easy to go to the computer, pull down the book, find the question you want, and get the answer you need right away without having to sort through lots and lots of chapters and lots of words.
I think the book does more than just inpatient palliative medicine, and I think that is a real need that the field has. So we talk about models of inpatient care, obviously, but we talk about models of outpatient care. We talk about the financial arguments behind palliative care inpatient, but we also talk about it outpatient. We talk about the role of spirituality and sort of the role that plays in the team. We talk about hospice. We talk about palliative care in long-term care facilities. So one of the things we tried to do was cover the spectrums, the entire spectrum where palliative medicine is delivered, and not just the inpatient setting, and I think that adds to the field as well.